Hello, everyone. This is Dr. Rakesh. Today, I'll be handling a session on ethics in counseling. Right. Without further ado, we'll start with the session today. So, definitions of ethics. So, ethics is a moral principle that governs a person's behavior while conducting an activity. Right. In this particular context, we'll be talking about what are all the obligations and responsibilities as a counselor. Right, you will have in meeting a client and providing them professional support, right? So the learning objectives for today would be about to understand what are all the ethical bodies and governing authority that is available in India. What are the terms to understand in that code of ethics? Where do you adopt it from? What are the ethical responsibilities and obligations as a counselor? And recent times we have been using a lot of video conferencing methods to reach clients for therapies and counseling. So we'll be touching a bit upon what telecounseling is all about. And when you are involved in research activities, what are all the obligations you have and what are all precautions you need to take. And when you have come in conflict with the counselee as a counselor, what are the legal consequences that you might face? So that you need to be aware of all those, in legality in counseling, right? The ethical body and governing authority in India is the Rehabilitation Council of India, which is involved in taking care of all the, you know, rehabilitation part, which includes, talk therapy like guidance, psychotherapy, and other stuff when it comes to rehabilitation in India. So what we do as counseling is basically, somewhere in the, ethical context has been put under the Rehabilitation Council of India. We borrow the a code of ethics from the American Counseling Association. So a lot of ethics obligations and responsibilities have been modulated from the codes that they have. So we borrow it from them. So it's basically the codes from that, and then the RCI is the body, local body for the country. Terms to understand. First thing is what you need to know about ethical codes, ethical obligations and responsibilities, what is ethical guidelines, and what are rules and regulations. Most of them will be, when I explain it, you will come to know what are the subtle differences between each. As I already mentioned, what a code is, codes provide a structure or a base to form the guidelines, like practical guidelines. So codes can also be used synonymous with principles. So while you're performing a professional activity, that activity will be based on these principles. So that is what ethical code is all about. You will understand it better when I'm going to give you what are the components of the codes, right? And what are the ethical obligations and responsibilities? As the name mentions, you are obliged to certain party or an organization or a person, right? So it's a moral and legal binding or a commitment, right, that you as a counselor will have to abide to while you're performing this professional activity. So which again I'll be explaining it, right? So obligations can be pertaining to an individual or an organization, and responsibilities as an individual you need to know, right? Ethical guidelines. So based on the code, as I already told you, based on the code or the principle and the obligations, the governing or the ethical body will lay certain practical guidelines through which you will be able to practice providing support to the needy. So rules and regulations are almost synonymous with the guidelines. So mostly they're all again rigid instructions to be followed during a professional conduct. Why this becomes a different thing altogether is because when it comes to the code of law, the guidelines become a bit rigid. So when it comes to clinical practice, you can use, as the name mentions, guidelines. So you can, there will be certain times where you need to be flexible enough, right? But when it comes to rules and regulations, it becomes a bit more rigid in terms of where the court of law just understands it by words in the guidelines, and there cannot be any flexibility. So maybe a few questions can arise in this part. We will take it up in the discussion. Okay, code of ethics to discuss in brief. So, as I already told you, we borrowed from the American Counseling Association Code of Ethics. So it says that whenever you perform a counseling as a professional activity, you need to all you need to understand is that you are thinking only about encouraging the client's growth, right, and maintaining a professional relationship, building trust and conserving rights and boundaries in terms of maintaining confidentiality, you know, and there should, as the earlier sessions would have already told you what you mean by professional relationship, or what do you mean by focusing only on the growth and the goals of the client, right, and skill development of the counselor. So it's the sole responsibility of the counselor to upgrade his skills by continuing to learn or update his knowledge, just like how we have people who have already completed different courses from various places, but still update through recent you know courses like this one. And American Code of Ethics American Counseling Association, in addition, also provides guidelines for training counselors, right, which is not pertaining to the session today. And it also provides certain obligations when it comes to research and publication, which will be dealing it in the later slides, and identifying and responding to ethical dilemmas. So all those guidelines are also being given by this particular body, but we will be touching it up in correlation with the RCI, which is the local Indian body which we have, right? Right. What are the ethical obligations and responsibilities? When it comes to obligations, you are basically obliged to the public, right? When you are, especially when you are trying to propagate your you as a counselor by advertising yourself, so you have certain obligations to fulfill. And once the client comes to you, then you have certain obligations to fulfill to the with the client, right? Or if you're not a freelancer and if you're affiliated to any organizations, there are certain rules that will be laid by the organization, so you have to be obliged to that as well. Responsibilities in this is more of responsibilities as an individual, in an individual manner, where you need certain boundaries that you need to keep when you are performing this activity, which we have already discussed in earlier sessions. This will be more or less obligations pertaining to the client, which has a slight overlay. And competence. So as I told you already, you are yourself responsible for being updated to your competence. And if you also have certain obligations in terms of providing only, uh, be honest enough to say what you are competent enough in your promotion or advertisement. And confidentiality and privilege, so we'll see one by one. So obligations first. So your obligations to public will include engaging in truthful promotions of practice, which is in the bottom of the slide, which says that in terms of letting the public know what is your educational qualification, your experience as a counselor, or in any other related field, and the performance. When it comes to, a few of them will have certain specifications in terms of family health, or child health. So all those things you should be accurate enough in mentioning it. And respectful to your colleagues and co-workers, especially when it comes to so when you're doing it, you're making sure that you are not crossing any barriers between your co-workers around the place. Or if you are in an affiliated organization, your own co-workers, what we have to do, what few things we need to be clear about in terms of uh, opening up on what you're exactly trained in. Obligations to the client would be preserving their confidence, which will be dealing it separately. You will come to know how to preserve the confidence, not only through clinic during the clinical interview, but also in terms of recording and record keeping. We'll be talking about it. Exercising unprejudiced and unbiased judgment, which is also we have discussed in previous sessions. Practicing only in your competence. So when you feel that you are not competent enough to take care of this particular problem, or if it's becoming too overwhelming for you to take care of it, which you earlier felt you could have, it is your sole responsibility to refer as soon as possible. So if any thing happens later on, then you cannot say that I thought I would have helped this person. So no, this will again fall into one kind of uh, responsibilities which we'll be talking about later. So practice only in your competence, and avoid or decline any untoward activities in terms of making or receiving any contributions to the client, or making or receiving any gifts, right? And obligations to the affiliated organizations. So refrain from making any false statements or any about work of your colleagues, or any other person in the organization, which would injure or the prospects, practice, or employment of the person. And encourage professional education and research within your affiliation. Uh, and a few exceptions would be about certain in terms of when you are outside, if you feel like, okay, if you won't have any price quotations or submitting competitive bids, or that would be predominantly for your fee, or any um providing any discounts. All those things can be exceptions. You can do it by yourself. You don't really not have to say it to anyone. And providing free services, of course, will not be any issue at all. What are the responsibilities that we'll be talking about? The first one will be about boundary violations. You can put it in treating in special ways, and one is next the transgression. Sorry, sexual transgression, right? Treating in special ways, especially when you feel like you get emotionally attached to the client. This is what I meant. Practice only at your competence, or at your um, when you suddenly feel a bit emotionally attached to them, you might feel that, okay, I need to help this person. I sending them to another person, I will feel a bit incompetent, or I should do this help. So spending extra time, either because you feel happy because you do it, to become emotionally attached to them, and going out of focus. So all these things need to be kept in mind when it comes to the responsibility as a counselor in a professional manner. Being available in the phone at all times, at odd hours, or non-working hours, could be also a boundary violation, which you might feel it's more of an free service kind of a thing. But it's later when there is a conflict, it's up to the court of law to decide how it could be. So being objective in that manner, and feeling, when I say objective, it means that what would the court of law think, and then decide about being available for on extra time is very important. Otherwise, later, subjectively, you might think it is for the good, but later when conflict arises, things might go against you. And as I already mentioned, exchanging gifts should be avoided. And certain sexual feelings of fantasies, which is which can happen in either the same sex or the opposite sex of the counselor or the counselee. But not letting into such fantasies or acting out on it, being aware that there are certain boundaries that you need to carry out, is very important. And involving in any affair or intercourse definitely has to be is not on question itself. So these are a few things that you need to keep in mind, or else there will be issues later. And yeah, competence, which I already mentioned. So determine this determines the qualification of the counselor. So through training. So for example, now that we are making this course, in the long run, maybe it could be certified. So all the certificates need to be, or the license need to be put up on the you know uh, place that you're working, right? And it has to mention the training quality and the experience. Currently we don't have any proper guidelines, but it will be decided by the court of law, if at all, if any conflict arises. Until then, it's up to the client to see, or it's up to you to be honest, to tell the public what kind of training quality and experience you have. And it's up to them to uh, have the knowledge, or gut feeling enough to take up that particular thing. So currently, that's what I told. Any governing body, currently the RCI, shall decide when the conflict arises. If not, it can go beyond, go to civil courts or any other authorized officials, right? And as I already mentioned, upgrading skills is completely up to the counselor, by updating his knowledge and skills by attending continuing educations, or any other courses, or advanced courses. And awareness on when to refer, that is beyond competence, very important. So we will anyway be talking about what are the indications for referrals and when to not take up the case anymore. All those things we'll be discussing in other videos. So according to the RCI, what does it mean? How do you qualify as a counselor? Right, currently there are so the RCI has certain organizations under which certain recognized organizations which it gives the green signal to handle certain certification courses on guidance and counseling. So we have had a session on what is the difference between guidance and counseling, but according to the RCI, it just keeps it a very layman terms. So it means guidance and counseling are almost similar for them, but we are trying to so currently certification courses in guidance, they do not have any prerequisite for enrolling. It could be any basic any kind of you don't have any you don't have to have degree or anything of that sort to get into guidance courses. So they don't have any particular organizations as such which provides certain courses in counseling, but demands is the process of making the current module as a certified course, which will be the information will come later through uh, the website. So there are other diploma and PG diploma courses, of course, which needs certain prerequisites, which is beyond the scope of today's presentation. So now coming on to certain obligations that we will be talking about is confidentiality. So whatever is said between two persons will remain a secret and will not be shared. So these are the three S's that you need to remember, right? When you need to, when you're helping a client, right? So storage, sharing, and security. These are the three S's where the competency could, the confidentiality uh, can be breached. So while you're storing information, say for example, uh, when you're talking, if you need certain notes that needs to be taken or any sessions that need to be recorded so that you can go back and discuss with your seniors or supervisors or your mentors, all those formal and informal verbal exchanges and written reports and case records need to be stored in a proper uh, either in an electronic device or in a, if it is an hard copy, you need to be secured properly in a reasonable manner. So what is reasonable, we'll be giving examples later in the coming slides. And sharing of information definitely has to be done with the consent of the client, to the family also, even if it's a family, and to professionals. Example, as I told you, when you're going to discuss this with your with your supervisors or your mentors, you need to inform the client that you're going to do this, and it's purely on academic basis and for their own benefit. That's why you're doing it. So that needs to be properly informed to the client. And if you're going to give it to certain social agencies, especially when it comes to any insurance aspect, if they're going to claim any insurance or all those things, that time it could, again anyway that comes from the client itself. So it needs to be clearly documented. So you're sharing this information because of this particular reason. And legal authorities, when it comes to civil court or court of law, if there are any conflicts, that time we might have to share the information. Otherwise there are no other way that you will share the information without the consent of the client. And security in terms of treatment while providing counseling, right? You need to be uh, clear enough where you're keeping these records. And when it comes to administrative point of view, where you record it, for example, if you're hard copies and you're putting it on files, where these files are kept, all those things need to be properly reasonably. So for example, if it's a, we're putting in an almirah, it needs to be locked, and the lock, the key has to be with the particular authority who should take the responsibility, right? Or if it's an electronic devices, at least a password protected computer or a desktop need to be uh, will be a reasonable protection. So if it comes in a conflict arises, if you have not done at least these things, then probably it could be considered not reasonable and you could be penalized for that. And when it comes to training, for example, when you're using these activities for training, as I told you, you might be going and discussing with your seniors or supervisors, or you might be showing these videos to your juniors to train, right? All those things needs to be told to these people, that these videos or the information of this client should not be shared beyond academic purpose. So make sure that you're keeping it to yourself and not sharing it with the public. So it would be secured there. If anything leaks through that side, again the same reasonable protection has to be there. And research, when it, again the same thing. So when it comes to research, you take a consent and then you store these documents properly, so that it doesn't get to the hands of the fourth or fifth party of that. So we'll talk about research. We will there'll be another slide which will tell you what needs to be taken care of. So, what are the exceptions when you can breach the confidentiality, when the request from the client is to disclose to anyone else, which has to be taken in a written, document, so that it's not only oral. So make sure it's every request happens or in written form with the signature of the client, and possibly witness as well. And another person is visibly present during the interview, and the client is okay with it. So asking them a question, that is it okay if you're gonna if we discuss this kind of issues in front of your uh, father, mother, or whosoever it is, and if they say yes, then that is also an exception, that the person is okay, the client is okay doing this. Supervised sessions, for example, sometimes you have the mentor or the supervisor who's sitting with you during the session, and again asking the client, that is it madam will be, madam or sir will be sitting with me, and she'll be helping us and go through the sessions. I hope you're okay with it. And no, is that okay? So don't be emotionally cohesive. Just say this is how it's going to be, and it's for the good for yourself. It's okay. So that will be one more exception. And referral to professionals. So when you're referring to a higher professional, say for example a psychologist or a psychiatrist, you need to give certain information to that particular health professional, so that they have a prime over the case, and so they will be able to take it up further. So that time you can again inform the client and refer them. Sometimes it's an implied consent, where if the client is okay with the referral, of course you're going to give certain information to the other professional, and only if they're okay they're going to give you that consent, so you don't have to mention it separately. And if it's a children or a child or an adolescent, you might have to ask the uh, consent from the parents and an assent from the child. When I say assent, is like it's okay, I'm just asking, but legally you have to take it from the parents. So coming to record keeping, there are, as I already told you, it's just a recap of what we've already mentioned. So when it comes to electronic recording or permission to access, uh, you know, when the client himself or herself wants the information about what has been going to happening with the therapy or the counseling, can I know the details of it? Somebody else is asking, or uh, uh, or I'm going to a different counselor or therapist. I need the details of it. So getting in writing that they need access to these data for so and so reasons, and then giving it to the client is very important. And they have all the rights to get uh, the information about them, right? And also in terms of electronic recording, also separate consent has to be taken, that this will be electronically recorded for what purpose, for academic or training purpose or research purpose, and telling them that it will not be used for any other purpose, and their identity will be uh, taken off. All those things needs to be mentioned. um, Permission to observe, as I already told you, and disclosure procedure, telling them that we are doing so and so things, being very transparent is what is mentioned. And duration of storage, it means that there is no particular guideline as of now for a therapist or a counselor, but when it comes to medical field, we'll keep it at least 3 years from the last visit. So from the last visit onwards, those patients whom we have seen, you need to have their case record either in electronic or in a hard copy for the next 3 years, and then you can destroy it. So during that point, 3 years, if anybody comes and asks for the record, you have to be ready to give it, which is in the medical field. Which again, I think you can follow the same for a but you will not be legally obliged, is what I see when it comes to counseling. um, and as I told you, reasonable precautions, like when you're going to store or data, at least locking an almirah and keeping a password protected computer or a system is very minimal standard that is required, so that there is no breach of data. Privilege, when it comes, as this is also already mentioned, when it comes to any legal action or court order, that time you have the privilege to break the confidentiality, which is, so the court might even call you for a testimonial to tell what has happened in front of the public. So that time you have a privilege to say, respond in public, or to the court of law, what is it. And when you feel, while you're assessing the case, and if you feel there is any risk of harm to herself or himself or the other person, if there is a case of suicide or homicidal risk, then you have a privilege to break the confidentiality and inform the particular officials, or their family, or other health authorities. Say, for example, in case of suicide, you can inform the other health authorities, like a mental health establishment, and sending them, giving them a referral, or informing a particular psychiatrist that you are sending and so and so client, or informing the family and bringing them and taking the client to a mental health establishment for admission, are few things that you can do without, you know uh, so where you can breach the confidentiality. Or if you feel there's a risk of homicide, then you can inform the police, or you can inform the particular, and you can uh, warn the particular person whom he or she wants to kill. So these are few privileges that you have where you can breach the confidentiality. Now, coming on to telecounseling, what are the ethics in counseling through the internet, right? So when I say tele, it means either audio call through phones, or through the internet, where you use mobile data or Wi-Fi, and video conferencing through where you can see, the face to face as well. Uh, while doing this, there could be a lot of issues in terms of non-verbal communications. There could be a delay in the internet. There could be some interruptions which can cause that you're not able to, not only non-verbal, there could be certain interruptions in terms of hearing as well. And when it comes to phone audio calls, there is no non-verbal cues that you can pick up. So these are few things that you need to keep in mind when you're opting for video conferencing. And silences, you don't know, sometimes the silences could be because of the patient going through an emotional turmoil, so she needs some time to respond to you, or it could be a genuine internet interruption. So those things will be confusions while you are using telecounseling. And privacy, for example, if you have not if you're not in a secure room like this, where you are not secure enough to say that that there could be somebody who can barge into your room, and if somebody sees the face of of your client, or if something happens of that sort, right? Those things need to be kept in mind if you're actually using a tele counseling. So make sure that you're in a secured room, so that no, and informing people that you're in a meeting, and there shouldn't be any interruptions or people coming inside. If at all anybody comes inside, you need to be cautious enough in assuring your client that this so and so person was entered is your co-worker, or the worker in your workplace, and confidentiality will be maintained. And telling that a prior will be a better option, right? But the safest thing is that shouldn't happen at all, right? And convenience. So once you say telecounseling, there is comfort that comes where you say that you can call the client, or the client can call you at any point in time. And whenever you are engaged in certain physical meetings, you might feel like, okay, let me postpone or reschedule the this particular counseling session. So all those things needs to be avoided. Make sure, since it's convenient, do not break the ethical issues. If you have got the schedule right, and only if there is a genuine reason, the rescheduling should happen, and it is not because you have uh, you know uh, you can schedule it any point in time, you can do it. And also telling the client that since you have the phone, it doesn't mean that you can call at any point in time. There should certain schedule we have already made, or during the working hours you can call and reschedule at any point in time. So that is advantage versus disadvantage of the convenience, right? And resistance, there's a lot of, because of the convenience itself, like the clients can feel that okay, fine, I couldn't call the counselor today, then probably I will call the counselor tomorrow. So having a certain kind of an subconscious resistance to attend counseling, and feeling that okay, this is not very seems to be very natural way of having a counseling, like a face-to-face counseling. So it more occurs more through video conferencing, which seems very artificial. So the people might feel resistant to call up, or feel hesitant to call up the counselor again. So all those things can happen, which are the pros and cons of telecounseling, right? And what are the guidelines that needs to be followed? Like for a doctor, it means that there needs an in-person detailed assessment. But as a counselor, if you have gotten any referral, it might not be mandatory, right? And always check for emergency or crisis. When I say emergency or crisis in mental health, it basically means violence or suicidality. Suicidality meaning wishes to die, and feeling of harming anyone else, or not being being medically fit also. So if you check for emergency and crisis not only in your first session, but every session, according to the body language and stuff, and the content that you get in that particular session, if you feel that there is could be an emergency, make sure that you don't hesitate to ask those three pointers, and maintain the same standards that you would do for a face-to-face counseling, as I already mentioned. All electronic communications also need to be documented. If you're not recorded, please document it as previous sessions, right? Put it in on paper. Uh, and an informed consent has to be taken as usual for any face-to-face. For even for tele, it has to be more, precise, telling about, if any breach of thing from a third party happens, then it might not be the you might not be responsible for it, and all those things should come in the should be committed in the written informed consent. And both of the parties, the counselor or the counselee, have the right to defer online counseling at any point in time. Could be because of any reason, because there is poor connectivity, or if there is if they feel that the non-mobile cues are not coming up properly because of poor internet connections, and all, or the audio is not clear from a remote area. So if the both of them feel it's not for the goodness of the progress of the client, then probably you can either change to face-to-face interview, or you can refer them to a higher professional, right? Research quickly. So when you do research as a lay counselor affiliated with somebody, it's very important to uh, get into ethical committee approval. Once you make a protocol, make sure that you go through an a local ethical body, right? If you're affiliated to an organization, your organization will already be affiliated with a particular ethics committee nearby, and it has to abide by the local IEC, that is ethics committee guidelines, right? And every research will have an informed consent about the research, and the client will have at any point in time they can get out of the study if they want to, right, without any reasons mentioned. And all these needs to be secured, data needs to be secured properly, and agreement on identification, say for example if you're using images, audio or video, all those things needs to be mentioned clearly. And if they definitely have to be blurred, their eyes have to be blurred if there is images or videos, and mentioning all these things clearly has to be put on an agreement and taken signature along with the witness. Okay. Legality in counseling. So when you come in the conflict of law, if there is an issue, you need to know these four, terms. So there could be the client could go to the court asking that there is a wrongful gain, that the counselor is unlawfully, personally, gaining something for himself or herself, for which he or she is not legally entitled for by doing this activity. So there is wrongful gain. So the client can go and say that this counselor is getting a gain from me unlawfully, or there is a wrongful loss, that loss by for the person by unlawful laws means which is legally entitled to process. That means that there is something that he has lost, the client has lost. It could be his reputation, it could be his uh, mostly it could be reputation, or his name, or certain, or it could be a breach of confidentiality where his information is gone, and probably people are telling that he's mentally ill or anything of that sort. So because of that, there is some issues. It happens, it's a wrongful loss. And SPDI is sensitive personal data information, and it has to be protected through reasonable security practices and procedures, as I already mentioned. At least this is what will be the concrete words that will be used in the code of law. So you need to have a reasonable security practice, and that reasonable will be decided by the code of law. And the few examples given in a lot of literature and guidelines is, at least, as I already mentioned, I'm repeating it again, at least the password protected system in case of electronic data, and proper, probably a serial coded lock to the Almira stuff, right? So, what are the penalties? There are no particular law that is dedicated for data protection and privacy, but a few provisions are there under the Information Technology Act 2000, right? Section 43A says compensation if negligent in using, reasonable security protection. So, there's no maximum limit for the penalty. So, either the adjudicating officer or the court will settle the case if according to the amount that is at stake, right? Section 72A, which is a criminal punishment if breach of confidentiality, it will be up to 3 years prison and up to 5 lakh fine, which can be either single or both, right? This is pertaining to penalties pertaining to breach in confidentiality. Otherwise, the other penalties that we are talking about when you get into sexual, you know, sexual activity, and then it becomes a rape case, then it will be, of course, dealt according to the IPC, and according to that, you will have, it will come under certain, categories of. Could be sexual harassment or rape, according they have specific categories. And since you are considered to be a counselor-counselee relationship, it will come as a assault under an aggravated sexual assault. So you'll be penalized according to the Indian Penal Code, and every then and there grievous injury, defamation case, and all those things will be addressed as per the Indian Penal Code. I would vouch people to go and be, you know, up to date with the laws and the penalties that are there. So those things I'm not discussing here, because it's as the law and the constitution itself says that we are all aware of it already. I'm not gonna touch it upon, because if I start discussing that, there could be a lot of things that you need to know about, right? Kindly go in and check those things on the Indian Penal Code. But if you're following the rights properly, if you follow the obligations and responsibilities properly, I don't think you need to be, so concerned about it. But this thing, the confidentiality part, is very important, because this is where most of the things you will be caught as a healthcare professional, mental health care professional, right? Okay. So the Indian Telegraph Act 1885 and the Information Technology Act 20 permits the government to engage in surveillance based on certain criteria, that is in the interest of the sovereignty and integrity of India. That means that they can do surveillance of any of our electronic devices, you know, uh, stating the reason that you could be, a person who is a threat to the country. So I'm just telling it at the very, worst case scenario. This is one thing that you need to be just aware, and it could be one thing that, when it comes to mental health, it could be debatable, right? Where it says that, if the person has a delusion of anything of that sort, there could be certain overlay on this. So I'm not getting into details. Maybe if you have any doubts, we can discuss it during the discussions. So the take-home message here is counseling is a professional activity and has regulations to adhere to, right? And the Rehabilitation Council of India is the current governing body for counseling and therapy-related professional activities in the country. Any person who claims to be a counselor should abide by the ethical codes, obligations, and responsibilities prescribed by the RCI. Awareness of the codes and obligations are thus essential for the professional conduct, and updating to the recent laws and acts are completely at the responsibility and competence of the counselor, right? And penalties upon any legal consequences aren't clearly prescribed in any existing law for counselors per se, but the governing authority or the officer, that is the authorized officials, shall judge on the already discussed act, which is the IT Act, and or both the Indian Penal Code as well, right? That's it on the ethics in counseling. Uh, we'll meet you in a different session and a video. Until then, it's take care. All the best.